and that is the whole idea of today's meeting. That's why we called it Q&A with Dr. Shayee and friends, questions and answers. I've received many burning questions from many of you, and I thought, this is an opportunity to answer in real time. So welcome everybody. The chat is going to be running while we're speaking, and we will be manning the chat as well. If we don't come to your question right on time, please be patient, bear with us, and we will answer it as we move along. Any questions so far? No? Okay. So I'm just going to tell you about the brief agenda for this afternoon. So we're hoping, to have this chat between 1 to 2 hours, depending on how the flow goes. And we'll start with introductions of ourselves, how we got to Canada, how we got to integrate what we do now. And after we go around the three of us, then we'll come back to me and the session on the questions and answers. So we'll take it in portions, maybe have the first portion, go through the flesh it out, and then go on to the next portion. And we have a very, very, very special person joining us today. She's a current resident. She's an R1, so her first year of residency, meaning she got in this year. And I invited her, to share her story, to act as a point of contact for many of us who are waiting to get in, to encourage us and to see it's possible, because her pathway wasn't the same as my pathway, very different, even though we both got into residency programs. So I thought it would be nice for you to hear that as you begin to put together your application for CAMPS again this year, and then of course, your questions. Dr. Undubuka, he'll be sharing what the Canadian Association of Nigerian Physicians and Dentists in Canada, what is all about, what they do, how they can help us as IMGs, what we start again, and every one of us is a member of a community. Some people like to go alone, but I'm African, and many communities in Africa have the saying that if you go alone, you'll get there, but it will be slower. But if you go together, it's faster. And which is why I host this community. But I didn't get here alone as well, right? I had a community, I had a village waiting for me. And that is where my president and this association come. From the name, you can see they're Nigerians, but I'm aware, with IMG Chronicles, it's not just for Nigerians, right? It's a big community for anyone who is an internationally trained medical graduate, irrespective of where you are, for you to have that information on succeeding, making the journey faster for you than it was for me. I'm sure you've seen it somewhere, how long it took me, right? So that's the whole idea. And the Nigerian communities did support me. And there are other communities out there, when you speak the same language, when you have the same cultures with some people, there's some things you may share more intimately than you would openly, which is why I encourage you to engage with members of that immediate community of yours as well. Don't be an island, It's not just about medicine, it's about our wellness, And our wellness is not just physical, it's not just financial, it's also social, So the Pakistani community, they've got a huge community here as well. They've got a group that I'll share the link to. I have many Ghanaian friends who are just starting to, put themselves together as well. We've got a Chinese community. So we have many pockets of communities, even amongst our big umbrella of IMG Chronicles. And I encourage you, to seek out your communities. As I get information on these communities, I will share them on IMG Chronicles. So for now, let's jump right in. I would allow my president to introduce himself, allow Dr. Sumter to introduce herself, and then I'll come back to me. So Dr. Undubuka, over to you.
Hello, good afternoon, everybody. Thank you so much, Shayee, for the opening remarks, and we really appreciate your convening this great session today for the purposes of what you have well articulated. So I want to welcome everybody again. My name is Namdi Ndobuka. I work as a public health physician in Prince Albert, based in Saskatchewan. I know some of you are from Saskatchewan, some are also from other provinces, and some might be outside of Canada. But we're very fortunate to have you today, and we look forward to a very fruitful discussion as we network to support your different goals in your licential pathways. And Dr. Shayee have already set the tone in terms of what we hope to achieve today. And it is my desire that whatever objective you've set for yourself in terms of your expectation in this session today, that you will achieve it at the end of the hour. Thank you.
Thank you so much, Dr. Ndubuka. And Dr. Ibezi?
Hello, everybody. My name is Somto Ibezi. I'm a family physician in Saskatoon. So I work in the community clinic, and I also provide family physician service at the Dubé Mental Health unit as well. And thank you very much, everyone, for being here. I can only say that this is the right place to be at this time. If you're looking to move to Canada, to find your people, to practice here, but most especially, you can practice here, like Shayee said, you don't have to go through what's happening here, but believe me, it is way easier to find your people in this journey. You need your village in this journey.
So well articulated. Thank you, Dr. Ibezi. I'm not a mind reader, but I would guess a lot of people are thinking, okay, so they're practicing in Canada, but how did they get to start, right? So I would like us to answer that. But first, let me introduce myself in terms of what I currently do. So just like Dr. Ibezi, I'm a family physician, but I work out of Alberta. And, what's interesting is I've never met Dr. Ibezi and Dr. Undubuka physically, but we've connected so much. There's so much we're doing together in terms of this IMG community. I would like you guys to say a big thank you to both of them, for joining us today. They're busy people. I cannot afford to pay them. But this is community service, but it is because they care. They care about what we do here. So thank you for joining us. So my last name is Akinola. So I'm Dr. Shayee Akinola. I'm an IMG just like you. I'm originally from Nigeria, and I moved to Canada in 2014, summer of 2014. So at the time, I was coming straight from a master's in public health in the United States. I went to one of the top schools. So I came here with a lot of high expectations, thinking the jobs were going to be running after me, but to my dismay, and I think my first culture shock was it wasn't quite like that. A year in, I was lucky to get into clinical research. So that brings me to my first point of no experience is lost. My master's was in public health. It was very clinical. I majored in maternal and child health. But then that first job I got was clinical research with GI, gastrointestinal department with their colorectal cancer. But I think it was the skill you're bringing in. Don't write off any skill you have, any skill set, don't write it off. So, the ability, to look at those papers, literature reviews and all that. I think that was one of the things that helped me niche that job, and I was on that job for 2 years, took my exams. Some exams I took more than once, right? But during that time, someone told me something very early on. The person said to me, Shayee, keep adding value to yourself. So I give myself timelines. This I have shared very eloquently on IMG Chronicles. And with those timelines, I kept asking, am I there? Am I there? When I left clinical research, it wasn't because I was asked to leave. It was because the time I set for myself and the goals I set for myself for that period, the time had come because I had strategized. I knew I wanted to do residency, not the practice ready assessment for personal reasons. And I'd set a time clock for myself that at this time, I needed to have finished my exams and I needed to apply because application is just once a year and you do not match until the following year. So that's 2 years. So if I am done all my exams today, I still have 2 years at the earliest before I start residency. So that clock was ticking on the inside of me. So what I did was I did my exams, took time towards the end, finished my exams. And when I was done my exams, even though um, application season hadn't started, I'm like, what next? What can I do to add on? In that time, I took all my life-saving certificates. And then I started working as a healthcare aide, with dementia patients, just because down the line, I have an interest with vulnerable population, underserved and vulnerable population. And you'll be surprised that here, the seniors also fall under that definition. And that was a part of medicine where I felt like I needed more training in. So I started at the very lowest rung of the ladder, right? But I was able to interact with family and patients alike. So I did that for a couple of months. And when I was applying for that job, I did not say I had a diploma in that skill set because that's a requirement. I was open. I said, I'm a doctor, but I want to have more interactions with dementia patients to be on the other side of the lens, and I think being open and being honest was a plus. And I did get that job. I was being paid $15 per hour, but I did that. In fact, when I matched into residency, I was still on that job. I left that job to start my residency program. But coming back to the end of residency, that job helped me get a job in a long-term care facility. It's the newest one in Calgary, and I didn't apply for it. I just sent a cover letter of what I was interested in. And I believe part of it was the skill set I brought from that time I spent with dementia patients. So who would have thought, right? And I know a lot of other people that from menial jobs they did. I know somebody who working with children with autism, right? She was a caregiver for a child with autism, and she did that for a year or two. I cannot remember, but today she's in residency in pediatrics. So do not discount all these things that you do while you're on the journey. They all add up. So fast forward to the end of my journey. In that process, I also, as a plan B, did the United Kingdom exam. So got the GMC license that if it didn't happen here for my timeline, I'll go to the United Kingdom, and I got ready. But then it happened here, thankfully. And I completed my residency program in family medicine this year from the University of Calgary. And I'm currently a clinical lecturer with the University of Calgary, one of the academic teaching sites, and I split my time between there and the refugee clinic, as well as a half day at the long-term care facility. So welcome again. So that's me in a nutshell and how I got to integrate here. I think overall, the process from start to finish, I got to Canada 2014. I started that job as a clinical researcher in 2015. I got into residency in 2019, 4 or 5 years later. But I've seen people who have done it in shorter based on information and guidance that they have received. The lady, one of the ladies who shared with me this year, it's been amazing how Young ING Chronicles is, that but we started hearing success stories. So for this year, 6 of the people I mentored got into residency, and one of them got in 2 years. She's only been in Canada for 2 years, and she got in. So don't think yours is going to take you 6 years. No, the reason we're doing this is so that it's going to be much, much shorter. So again, I hope it's going to be a full and rich afternoon, time well spent. And I'll hand it over to Dr. Undubuka to share his story of where he came from and how he got to start practicing in Canada.
Excellent, excellent, Dr. Shayee. That's an amazing story, very inspiring. Thank you for sharing those. So just to piggyback on some of the comments that Dr. Shayee made, I think one purpose, again, of today's meeting really is to encourage everybody. No experience is a waste. Don't think that what you're doing now does not count. It does. As a matter of fact, a colleague of mine who had an ultrasound experience way back in Nigeria had to put that in his CV to get a job prior to his becoming licensed here in Canada. And for that particular job, which was quite rewarding at the time, the only line that they picked from his CV was that he had an experience in doing ultrasound for OBGYN. And that was how he got that job. So why am I saying this? Whatever skill set you think you're picking up right now, whatever you're indulging in, trying to still participate in your licensing journey, don't discredit it. Don't think that it does not add value. It does. So with that, I started my journey back in 2004. When I left Nigeria, I went to Botswana. Botswana is a very small country of about 1.2 million people at the time in Southern Africa. So that's where I really started my journey as a family physician then. I did develop interest to go into public health, and I started some studies across the border in South Africa, where I did my master's as well as my PhD, which I was very motivated to do right away. Also, while still working in Botswana at the time. All the experience that I accumulated in Botswana after spending about 8 years in that country, and decided to move to Canada in 2011, arriving here in September, was a decision that I have not regretted. And I say this because, we may all be comfortable where we are, but at times the push and pull factor, there's a stage in life where it is no longer about you. It's no longer about yourself, but it's about your family. It's about your kids. You want to give them a better head start. And I think that might resonate with most of us here today. And we've set a path for ourselves. I didn't want to go into primary care. I didn't want to be a family physician. No offense to my wonderful colleagues here that are providing excellent services as family physicians to their community. But I had very strong passion for public health, which actually, inspired me to start going through that path earlier on. I did not go through residency in public health. And again, this is a very strong point that I want to make. For Saskatchewan, we're fortunate to have a system that have pathways for physicians who had their public education through residency and also through either masters in public health with additional experience. So that was where I, plugged in and was fortunate to get a job with the First Nations Health Authority here in Prince Albert as a practicing medical health officer. Also went through my licensing exams, and one challenge that I had was my English exams. And it might interest you to note that I wrote that exam 7 times. Unfortunately, each time I get a very narrow score. They say, oops, it's either it is speaking or it is the writing or it is the listening. 1 point will always be missing. But I kept going on, and I was inspired by the fact that someday it will be good and I will get there. And that was the goal that I set for myself. So in case you might be in that category where not just the English, but any exam is becoming a challenge, do not give up. Just keep your eye on the ball and take advantage of the network that we are continue to build within our community here in Canada. You will get to that mark where you will think that those will all become history, just like birth pains. So here I am today, working as a public health physician within the First Nation Health Authority within Saskatchewan, also creating great networking with our colleagues in primary care. I'm also fortunate to be working with the University of Saskatchewan as an adjunct professor with the School of Public Health, and also an assistant professor with the College of Medicine here in Saskatchewan. And again, most of the research experience that I acquired from Botswana and elsewhere have also led to some of the great expertise that I've continued to provide to our population here in Saskatchewan. So I really want to encourage you all that you can make it. You can make your goals well articulated and achieve them. What you might need might just be, information here, information there, knowing somebody who knows somebody there who will give you the right information and who will give you the right support to achieve your goals. And those are some of the things that we will also discuss today within our CANPAD mentorship program, and where the IMG Chronicles that have continued to do an excellent job in supporting yourselves, and we will build a community here. So with that, thank you very much for this initial round of introduction. And I will then hand it over to my amiable colleague, Dr. Ibezi.
Thank you, Namdi, Dr. Ndubuka, calling me Namdi. But one thing that Dr. Ndubuka did not mention, I think he's too modest, but he's actually the Chief Medical Officer of the Intertribal Health Authority. So he's a boss, just so that you know that, just so that it's on record. My name is Dr. Somto Ibezi. So my journey, I think someone's audio is on. Wait. So my journey to Canada started. Shayee, can you mute everybody, please? No. That's better now. So my journey to Canada, to Saskatoon, started from the UK. So I qualified medical school in Nigeria. I think there's some Uniport people here. So graduated from Uniport, moved to the UK. So moved to the UK, did my exams. It's interesting that everybody seems to have a common theme, which is that you always meet that exam, which you have to do twice or 3 times. And it's always a shock to the system, because the type of profession that we're in, we are used to excelling. A number of us reached through medical school, not because it was easy, but because you study and you get the results. And I'm assuming under standard temperature and pressure. So moving to the UK was a new lifestyle for me. And I think it's important to highlight this, even though we're talking about Canada, because that's where my journey started. And I know there are some people who are in the UK or plan to go through UK to end up in Canada eventually. So I got there, did my exams. The PLAB 1 exam, I did that during my house job in Nigeria. So I studied, but everything was favorable in the sense that where I happened to do my house job was actually opposite my parents' house. So I lived in my parents' house. I had my laundry done for me. I had my food prepared for me. I just had to go to work and come back, and I did my exams. And I passed, and I felt like a superstar. Then fast forward, moved to the UK, studied, did my PLAB 2, I failed. It was a shock to my system. But the good thing was I had some people who were close to me who were not in the medical field, but they've been in the UK a bit longer than me. And their advice, the day the result came out, and I told them, I was still bawling my eyes out. They said, when is the next exam coming up? I said, I don't know, but it's probably open today. They said, okay, wipe your tears, get on that computer, register for the next exam, and then you can continue crying. So that was what I did. So the day my exam result came out was the day I registered for the second trial. And I continued my crying, feeling sorry for myself, and eventually did the exam. So got my UK license, got a job as a senior house officer, which is like a trust job. So you're not in a training position, you're just working as a house officer. But I didn't know people in the UK to put me through. I didn't know people one-on-one to ask questions. So I went to work every day and came back, and at the end of each month, I would call my mother, who's in Nigeria, and cry and tell her I don't know how to get into the system, and that my certificate was getting old. And she said, just go to work and come back and talk to people. That's what she told me. Talk to people, let people know what you're looking for. You never know where your help is going to come from. And that was what I did. And I remember vividly the day I was on call. I was doing orthopedics as a senior house officer. And the reason I was going to enjoy it, for me, it was just a job. It was a foot in. But I did orthopedics for 19 months in the UK. So one day I was I was taking over the on-call group from somebody who was in general surgery. This guy is Pakistani, and quiet guy will occasionally say hi, or we moan about the on-call, like how busy it is. Because when you're on call, you also cover orthopedics and general surgery. So he said, so how long do you plan to do this? I said, I don't know. I don't know how to get into foundation program. It seems there's no vacancy. And he said, no, you don't need to go through the foundation program. What do you want to do? I said, I want to be a GP. He said, no, you don't need to go through the foundation program. How long have you been here? I said, just over a year. He said, go online, print out, just Google the competency form, that there is a competency form. I'll find it under the foundation program competency form. And I just need to ask one of my consultants to complete it for me, because I have been there for 12 months. Actually, you just need to have worked in that job for 3 months. But he said, you've done more than enough, so you shouldn't have a problem completing it, because it was a tick box exercise, but you're supposed to tick for every like rotation, there's specific skills. And he said, there is no way you would have covered all those skills between general surgery and orthopedics. So that day, I didn't go home. I sat back at work and I printed out this form, and it was that easy. I took it to one of the consultants, and he says, oh, I was wondering when you were going to get the form to me, because unless you wanted to do orthopedics. I said, I didn't even know about this. So he completed the form, and I applied for GP training, and I got the GP training. I got the first iteration, completed my GP training. Of course, then there was the usual delay, had babies during the training, so family life and GP training. But got through that. And I'm mentioning this specifically because I know there are some women, some mothers who wonder how to get all this done at the same time, especially when you're in your country. And I'm mentioning this to let you know that it is doable. It is hard, but it is doable. And that's all the more reason why you need your village, because you don't have time to waste. You don't have time to make many mistakes. You just need to speak to the right people who have been through this journey, and they can tell you what they did wrong, what they could have done better. So that cuts so many steps for you. So completed my GP training, and we made a decision as a family to move to Canada. I looked at so many provinces. had trying to marry the needs of the family and our desire to come to Canada. So I looked at different provinces, chose a province, wanted to come to, which was Saskatchewan, which sounded crazy at the time with the temperature, but I'm happy I'm here because it's the right decision for my family. So, and I went online. Like I said, I didn't know anybody who could give me information. So I went online, did so much search, put the kids to bed at night after work, and spent so much time on the computer because I was searching through Physicians Apply, I was searching through MCC, I was searching through the various provincial websites, the colleges. And one day, my husband said, well, just send an email. Somebody will answer. Somebody, just send an email. And I sent an email to one of the contact addresses for the colleges. And this person responded with all the information. Everything came in one email, the pathway, there were so many links. So I started that email, and that was one thing that I always went back to look at. So what step am I in? And why I'm mentioning this again, because it's important to reach out. You don't know what you don't know. And it doesn't hurt to send an email to a college or any office that just say you're looking for information. There are people there who will answer any question you have. And if they can't, they will direct you to where you go to. So got all this information. While I was still in the UK, I did my EE exam, which was still going on then. And I realized that coming to Saskatchewan, you didn't need to get your QE1 or QE2 to come in, because I had my UK qualification. I came in on a provisional license. So I came in and I started working. And while I was working, I did my QE1 and my QE2. So everything was done within a space of a year. Did my exams within a year, and got my got my full license. It's called regular license here. And yeah, I've been here. Incidentally, when I came in, my first job was in a practice in the community in Saskatoon, and I'm still in the same practice because I was lucky to find a good place. They gave me soft landing because they were really helpful. So while I was doing all this, okay, I have come in here, I have my license, then what next? I felt something was missing. I went for a certain event, just know what's happening, because you want to get a feel of the place that you're settled in. And I told somebody at the meeting that it felt like I was hearing the music. I could hear the music. I was at the event venue, but I couldn't find the door to get into the event because while I was working, I had some other interests, other things that interested me. But I didn't know how to get in there. So whatever your interest is, whether it's some subspecialty or governance, you need to ask questions to know how to get to these places. And then one day I went for a leadership program here in Saskatoon. And I said, you know what, I have all this funding from Provincia, I should be using it. Fine, I'll sign up for a leadership program on leading with emotional intelligence, I think. And that was where I met Dr. on the book. I said, okay, there's another Nigerian there. So there are so many of us here. Now I need to find. And then he took my number and then he added me to the WhatsApp group. And I was surprised the number of Nigerian physicians in Saskatoon alone. And I haven't looked back since. I am happy I found my community here because now, an example, so now I work at the Dubai Mental Health Center. He was another Nigerian who I didn't know there was anything like that. She said, oh, there's an opening for a family physician at the Dubai, the psychiatric unit. Are you interested? And I'm like, yes, of course, sure. I mean, I am interested. And that was it. That was the beginning of that journey. So while it's good to come to Canada, you can come in alone, but if you find your people, it is way easier. Yeah. So thank you. That's my journey.
Wow, 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 wow. You know, women, no offense to the men, you know, women are amazing. When you talk about resilience, you know, managing all of this with family, you know, is not an easy task, but they always come out on top and make it look so seamless and effortless with a lot of packaging. So thank you, Dr. Ibezi. That was very, you know, inspiring. And I will tell the group something. Dr. Ibezi is the current vice president of the Black physicians of the whole of Canada. You know, so she gives a lot of herself, you know, for all these causes that she believes in. And how did we connect? She reached out to me because she saw something I did. Maybe IMG Chronicles, maybe something I shared, you know. And she reached out to me and said, I like what you're doing. How can I get involved? You know, and there have been many, many, many doctors who got to this country before she did, right? So, but she reached out. She was the one who reached out. So that just says the testament of the kind of person she is, you know. So thank you again, you know, for your time, for giving of yourself, and for making this cause something you're passionate about, because it doesn't have to be your business, but you've made it your business and we're happy that is your business. So thank you. At this point, I would like to open the floor. Do we have questions so far? You know, we've all been hearing our voices, all three of us. I would like to have a feel of the audience. You know, you can shoot a line where you are right now. Are you in Canada? Are you outside of Canada? And where you are in your journey, where you are in the process, are you still taking exams? You know, what you would like to hear from us today. You don't have to wait till the end for that. So right now, the question board is dry. Oh my goodness. We have a friend from Uganda, Akampa, welcome. This is exciting. All right, so go ahead. You can unmute yourself, Akampa. Unmute yourself. Let's hear you. Dr. Ndubuka, do you mind unmuting Akampa, please?
Thanks so much, Dr. Ndubuka, Shayee, and Dr. Ibezi. As I've just said, I'm Dr. Akampa Mokove. I am from Uganda. I'm a family physician. It is really so great to learn from you guys. It is very inspiring. I particularly love what you said about wanting to work together and lifting up others. In the world today, it's really something that I cannot take for granted. So I'm really, really thankful for this session. I've watched some of the YouTube stuff on IMG Chronicles, and I've also listened very carefully about what all of you have said today. Some of my, what I'm going to say are questions, but also clarifications. So I watched a clip on YouTube about the issue of currency in practice and the challenges that people face. So do you think, I feel like it may not be wise to leave your country until either when you get a spot, either in residency or the practice ready spot. I don't know what you think about that, but I feel because of what I watched you mention, that is something that, so maybe, do you feel people should wait to travel to Canada before they get a spot, or do you think it's safe to travel anyway? But from what I was watching, I feel like it may be safer to stay in your country to keep up with the currency and practice issue. The second question is, if you get the LMCC, if you get the licentiate of the Medical Council of Canada, is it better to apply for residency or the practice ready route? Dr. Shayee, you did mention that your choice was residency and not practice ready. I wonder why. I wish you could just share your own experience and why. Then I don't know if you could advise, my third question is, I don't know if you could advise which province has the easiest practice ready process. Then Dr. Ibezi, I wanted to ask you, and I think also Dr. Shayee, you both did the UK exams or got licensed in the UK, but then still chose Canada. Are there any particular reasons why? Again, I've watched on YouTube, I've watched comparisons of the two countries, but I'd like to hear what your own personal views are and why you chose Canada anyway. And then given that you've done both the UK and Canada, do you think it is wise? Is it indeed wise to sort of spread your eggs in all these baskets? Is it a good thing to do both the Canadian route and the UK route? And if so, it's quite expensive. Is it worth it to pursue both these routes? Is it worth it at the end of the day? Sorry, I'm asking so many questions, but my last one is, I have seen as part of the express entry route into Canada, you have a higher score if you have a job offer. Is this something that the Black Doctors Association can help an IMG who is trying to get? But if not, is it easy to get a job offer in the medical field? Not necessarily residency, not necessarily the practice, but something medical. Is it possible to get a job offer as you settle and try to then get to do the exams and all that? Maybe one final question, sorry, to Dr. Shayee. So again, I watched the YouTube material, and I've noticed that you've finally got licensed in Canada almost at 40, even though in your home country you got licensed at 24. So most of your 30s you've been doing this process. Again, is it worth it? Has it been worth it? How do you feel about all that? So those are my questions. I know I've asked so many, but I think they may help to throw some light to some of the people who are listening. Thank you so much.
Thank you so much for your questions, Dr. Kamba. I had to write them down, but we're happy you asked all of it, because just the same way you have asked, I'm sure there are many who are thinking some of those things you've highlighted, but who haven't voiced it out. So we will all learn, from your questions and our answers provided. Dr. Ibezi, do you want to go first, or do you want me to go first?
So I'm happy to go first to, I think the question that Dr. CANPAD directed to me was about coming from the UK and being here. So what made me move here, and is it better? So when I left Nigeria to go to the UK, it was for family reasons. However, when I got to UK and started my residency training in the UK, I actually did not plan to move to Canada. It wasn't, as of then, it wasn't as a step to moving to Canada. But at some point, towards the end of my training, something changed. And for me, it was some people might disagree, but the political environment, I just wasn't happy with the way things were going. But again, but that was for me, that was my view. So with the whole Brexit and everything, I felt, okay, I needed to make the decision to leave. Was it going to Nigeria or going to Canada? Prior to that, I have to say that I had some encounter with Canada prior to that. That was some years ago when my spouse worked in Canada, worked in Toronto for a bit. So even though I was in the UK and he was working in Canada then, it was an encounter, and I liked the times we visited. I liked it, so I think that opened that up for me as an option. Oh, yeah, the main thing that made me move was the Brexit. I just didn't like the way the whole politics of the place was going. And I'm not saying that it is rosy in Canada. It is not. It is not. But for me, I lived in London. I didn't want to move outside London. I had so many things to consider with the kids and their schooling, getting into the right school. So yeah, a host of personal reasons. And there was also the attraction of practicing the way I wanted. You have more leeway in Canada in terms of what your practice and what you can do. There was less restriction. So UK over time has become super specialized, that there are lots of skills that as a family physician here, I could not use those skills in the UK because you have to refer on to a specialist or subspecialist. And I didn't like that. So the attraction of providing comprehensive healthcare, so you can take delivery, you can catch babies, you see people, you can provide palliative care, end of life care, geriatric care. That was one of the attractions for me. And then since coming here, I am happy that I am here. Maybe I'm just making the best of what I have, but I am happy, and as of this week, I have no plans of going back to the UK, so I guess I'm happy here. I hope that answers the question for Dr. Camper. So at the end of the day, it's about you and your family. Of course, a lot of my colleagues stayed back in the UK, and they have no plans of leaving the UK. So it's a personal decision.
Thank you so much, Dr. Ebezi. And I think the second question he had was for the Black physicians of Canada who you represent. He did ask that, was there a way to bridge, if he was trying to move to Canada, was there any way you could offer support as that organization? Dr. Camper, correct me if I'm wrong on paraphrasing what you said, but I think that is what I heard. Okay, I think you can go ahead.
Yes, that was it, yeah.
Okay.
Okay, so like I said, currently I wear many hats, and the hat I'm wearing today is as a CANPAD member, where I'm the area coordinator for Saskatoon and area. But the other hat I wear, which is what's on the poster, is the Vice President of Black Physicians of Canada. The answer I can give to that question is currently, the short answer currently is no. However, there is a lot of things going on, and CANPAD is also involved in making Canada more welcoming and hospitable for IMGs. So currently, no, we don't have that kind of influence yet, but there is a lot being done to make it easier for IMGs to make Canada their home, their practice home.
Yeah, thank you for your response. I'm just going to add a little more regarding that question. So over and over, I have said it that immigration and integration as a doctor are two completely separate things. So unfortunately, Canada is a country where if you do not have their legal residency program, So I'm not talking medicine here. I mean legal papers to live and work in Canada. So if you come on a visitor's visa, for example, there's not much you can do in terms of, as a medical doctor, in terms of your future career integration. So that is a door they have closed effectively. So Canada is welcome to people who have their permanent residence or Canadian citizenship. And the way you get a Canadian citizenship is by living here as a permanent resident for 3 years. So all this information is, there are a lot of people who've got that permanent residency, but do not want to just come and sit here and wait, which is an issue you highlighted. So those kind of people already are one step ahead of the game, right? You've got the paperwork to come here. So that is unfortunately something Canada has effectively blocked, unlike, for example, a country like the UK, where you can register for the exam even if you're on a visitor's visa, or even if you're in Uganda or in Nigeria, wherever, you can do their exams. So I hope that answers one part of that question. The second part of that question is with regards taking the exams. So for some, when you can take the exam, you can pay for the exam, there's a detailed video, I think I called Relocation 101 or something, of how to apply for the exams. But when it comes to the point at which you want to apply for residency, they would ask you to submit a copy of your permanent residence or of your passport. And it is at that point that they cut people off, right? That said, if your eventual goal is towards relocation to this country, then nothing is lost. You can remotely start taking your exams, even if you do not have that permanent residence yet, while you are working on the process, because it does take some time, right? It's not immediate. So you can do the two concurrently. And you are so right when you talked about how expensive this process is. It is an expensive process. I think this is the most expensive country in terms of taking the exams and integrating, as compared, when you compare to Australia or the UK or even the United States. Our exams are the more expensive exams. So that is how those pathways are parallel. Now, how do you get permanent residence? Black physicians of Canada have zero affiliation with the Canadian immigration. So the body who is responsible for that is the CIC. So hello, have I been muted all this while?
For a few, maybe for about a minute.
No, just less than a minute, yeah.
A
But
few
you're
seconds
good.
ago.
Yeah,
Okay. All right, thank you.
go ahead.
So this is
Okay.
just the immigration website. So for others who haven't become permanent residents yet and who are on that process, that's the immigration website. It's very different province to province. You have to look at what each place is requiring and seeing what you have, or what your spouse, if you have a spouse, you can look at what your spouse is bringing to the table, because sometimes your spouse may even have more points, right? It's a point-based system, and there are many factors, that contribute to you getting that permanent residence. So I encourage you to look at that. And if while you're in the process, you need some more help, I can connect you with some lawyers that may be able to help. So it's a legal process completely separate from today's conversation. Today's conversation is, how to help you settle in, as a doctor in the system, or about getting into the system. I think I have the bulk of the question, so I will go back. So you said, why residency? Dr. Ibezi stressed a lot on if personal reasons, personal reasons, personal reasons. So you always have to tailor it to what worked for me and what works for the people with me. So for me, I came here with a young family. When I came, my older kid was 6 and the younger one was 3. So a 3-year-old preschool, but a 6-year-old was already in school. You know, he had completed the equivalent of grade 1 in Nigeria. And unfortunately, prior to that time, I mentioned earlier that I was in school in the US. So what I didn't mention was that I went to school alone. So I left these young kids in Nigeria for 2 years, right? In my pursuit of whatever, you know. So now we're coming as a family, and I didn't have an income. Our life savings had been spent on school fees in the US. So we needed an income, and my husband stayed behind in Nigeria. So I could have pursued the practice ready assessment at that time, you know, and I was still current in practice. But the reason I didn't was because the chances of going to a rural area was highest. I didn't want to go to a rural area. I wanted the kids. So we were coming from a city of over 20 million people. So I wanted the kids to still have a semblance of the kind of life, the kind of environment they grew up in and we're familiar with. You know, I still wanted connection with people. I didn't want to go be the only physician. I had a couple of friends where in the communities where they were practicing, one of them was practicing in a community of 800 people, and she was the only Black family, you know, so everybody knew this was the doctor. And when she goes to the grocery store, they knew exactly who she was. Her kids were the only Black kid in class, you know, and a lot of them, a lot of these communities were very myopic, you know, the communities had just started opening. So it's not like, you know, it was like the UK where everyone is different shades of color, you know. So I really wanted that. And that was why I said I want, so that was one reason I stayed here, you know, in terms of not pursuing practice ready. The second reason, so I'm in a city called Calgary. The second reason was at the time I came, that year and the year before, Calgary had just gotten an award for the fastest growing for young immigrants. So economic migration, it was #1 at the time. The oil and gas industry was still doing well. So for my spouse, who I knew definitely would get a job before I finished my exams, you know, it was a good idea to remain here as well so that he could also work while I studied. So that was the second reason. And then the third reason for me was I looked at my resume, and my practice was very varied. Yes, I did mostly women's health in Nigeria, you know, but I had skills that converting to family medicine, I could do, I had my set interest, and I felt that just going to a community and being the sole physician by myself was not part of what I wanted, the big picture. You know, I wanted to be a contributing part of a big institution, which is thankfully what I'm doing now. So I had looked ahead and I felt like doing residency, you are part of the system. So it's not like you're not with those that do practice ready. It's just that with residency, you actually get to sit down with the decision makers. You actually get to know what is happening. You get to know the root cause analysis, right? You don't just take off the band-aid. You're part of suturing that wound and what exactly is happening. And if I could get that opportunity firsthand, why not, right? There's some doors that haven't trained in the system are opening today, you know? So I felt like age-wise, I was still ready to try. Secondly, skill set wise, I felt like my resume was robust enough, you know? I felt I had good clinical experience, I had research experience, I had a global view, you know, so I felt there were many things that put me in a good stead to try, you know, but on the other hand, I was also mindful of the fact that many people with even better resumes than mine had tried and didn't get in, you know, which was why I had the plan B, you know. So why UK? I did the maths. I had on my table UK, US, Canada. And I don't know if you know this, but if you have the LMCC from Canada, you actually can work in Australia. You know, you can, if you get a job, if you get a recruiter in Australia with your LMCC, you can work in Australia. You know, but for me, Australia wasn't an option at the time for family reasons. You know, I didn't want to move my children again, but I wanted somewhere not far from Canada that I could commute with the intention of coming back home to Canada. And when I looked at the cost of these exams and the process, the UK was the most straightforward. So it took me 6 months from the first day, from the first exam I took, it was 2 exams, and getting my license in my hand. It took me just 6 months. And I don't think there's any other country, at least at the UK of right now, post-Brexit, has been very embracing. I don't think there's any other country where it's that short and the process cheap, not cheap, but more affordable than the other countries. So that was why that was my plan B. But I did not plan to stay there. I didn't plan to stay there, one, for stability. And then when I look at the quality of life, you know, I've been driving on the right side of the road since, or I've never driven on the, like, you know, I mean, that is a very minute reason, you know, but in terms of quality of life, their way of life in the UK is very different from ours. Personally, I believe we have a better quality of life, and that was important for me, you know, including the political environment, right? The North American system is very autonomous, is a community where your rights are really valued, where you speak up without the fear of anything, where even people like Trump can be president, you know, and then at the next election, someone else comes in without anybody killing themselves. And same for Canada. Canada is also very family friendly. So for so many reasons, it wasn't an option to remain in the UK. And we've got many friends right now who are doing their training in the UK. Some of them are here online today with the intention of coming back home to Canada. Canada remains home for them. And I think even in terms of physician fulfillment, like Dr. Bezi said, you can tailor your practice here to whatever you want it to be, however you want it to look like. You know, you can tailor your practice, and there are more restrictions over there. So that's why that choice was made. Now, for your currency of practice, should you remain in Uganda? So that's a deep one. You know, I said earlier, you can do your exams well outside of Canada. So the QE1, very recently, I think last year or in the last year, you know, they've opened up more centers worldwide. Before, you could only do that exam in Canada. So it's a written exam, it's not clinical. Now you can write it outside of Canada. So I think it's wise if, you know, especially if you do not have your permanent residence yet, you know, I think it's wise to write your exam remotely. Try to apply for a visitor's visa so you have an idea of what this country looks like, you know, and then you can tailor a visit to the same time as doing a clinical exam. The world is now one big global village. You can do classes remotely. You can do remote classes with people. Chioma just mentioned that QE1 can be written at home now, remote proctoring. So that means even in your house, you can write the exam, right? So so for that reason, you know, you can keep having your currency of practice, and at the same time, you're making progress with your exam. So you're killing two birds with one stone, essentially, right? So looking back with that opportunity, definitely, you know, but would I have taken it if I had the option? It would be no, because my country where I was coming from was it was at a time in the life of my country that I was no more feeling safe as a citizen, security wise, and unfortunately, physician welfare and well-being, you know, is not something that my government has invested in. So I wanted out immediately, and I think I'd rather have come here to work in Walmart, you know, than continue practicing in Nigeria at the time I left, right? So back again, personal choices and what your current situation is like. Easier province to practice. There's no such thing as an easy province to integrate in. I think 4 years ago, I would easily have said, oh, Saskatchewan, and that was because it was one exam and then your English. 6 months after I got to this country, they changed that. They added a second exam. I did that second exam 3 times. Then after that, a year later, they added another exam, then another exam. And last year, they've added another exam. So that's Saskatchewan. It's changed, on IMG Chronicles, we're talking about practice ready assessment, and we're going to be talking about province by province. So we've only addressed Saskatchewan. So other provinces that right now are welcoming IMGs, without residency training. But remember, this is tailored to family medicine. So it is IMGs who have family medicine experience and training. Those are the people they're talking to. So British Columbia has a robust one too. And I've heard of a couple of people who actually got work from outside Canada. So they got a work permit directly from the province of British Columbia. But this was 2 years ago. I don't know about now. So what I do before each video is I engage with people who are in the system, who have recently gone through that process before I come and say anything to you guys. So hopefully by the time we're talking about BC, somebody who is more informed than I am can say something as to work permit. Manitoba runs 2 concurrent programs for IMGs. So one is a 1-year program where if you've had previous training, and you have currency of practice, they will train you for just 1 year, and that program, I'm not sure how many they admit every year, but they'll train you for 1 year and you have a return of service for 4 years. So in total, 5 years, right? So, but that's one way. And then the second way is something like what Saskatchewan is doing. So each province is very tailored, is very different. There's no easy province, but you have to look at your complete picture and the dynamics. Look at what each province is asking for. Look at what you have, and then you try. And I've told someone, you know what, try all of them. You're not paying to apply, right? Try. It's not like residency where you're paying. Try. You never know which one is going to work out. Resiliency is something that is so important on this journey. So just try. And then, is that all? I feel like I'm missing something. Did I address all the questions?
Is it worth it? Is it worth it? Has it been worth it all these years?
So for me, it is completely worth it. When you talk about, of course, when I left Nigeria, my colleagues were all consultants, working and all of that, and I look back now, I left Nigeria in 2013 to the US, and that's 8 years ago, right? And I only just started practicing now. Do I feel like I wasted 8 years? Absolutely not. I'm enriched in very, 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 different ways as a person, but I think the biggest joy I have is I see my kids and I'm just thankful, the exponential growth on every ramification. They have no idea what process this is for me, right? But they have grown and I have opened doors for them. Does that even if I was traveling every year in Nigeria for summer abroad, does that, it won't open, right? So that exposure. So I am an immigrant, but they are Canadians. They're more Canadians than I would ever be. So I think I have allowed them to sit at that table, right? No labels. And that is what I have done for them. For me, I would still identify first as as minority radicalized, but they have no labels. This country belongs to them as much as it belongs to Trudeau's son or daughter as our prime minister. And I think that alone gives me a lot of joy. in terms of my career, I talked about the country I was coming from, the practice opportunities I have now, being able to request for something for your patient and is available, being able to actually, what you want to do and you have the resources to do these things, you have the support. And even when you do not have the support, you can speak up, right? And that is very big. And in terms of financial remuneration, of course, I'm just starting all over again, that will come, but it is not comparable in any way, back home. So do I regret it? I don't regret it. I just have to work extra hard. By the grace of God, I want to retire by the time I'm 60. So I just have 20 years or less to work in good health, right? So it just means I have to be very strategic about the next couple of years. But I don't feel like I wasted my time. I think it was worth it every single step, So that was a lot of questions. That was like 6 people's questions, but I took my time to answer it because you were our first person asking and you were all the way from Uganda. So, and I'm sure many people gained from that. So why don't we, I said we'll do this in segments. I'm looking at the time. I think we're just a little over an hour in. So why don't I hand it over now to Dr. Undubuka, to speak to what CANPAD is all about, which is our community. How is our community supporting IMJs in this work? And right after his presentation, we'll go to the next step of questions. I am seeing everything. The only thing I'll ask is for those sending it to me privately, why don't you share question publicly so that everyone else can see the question. So all your questions will be answered in due time. All right. So Dr. Ndubuka, can you please mute everybody and then you
Thank you very much, Dr. Shayee, for those again wonderful comments and the response to the question. Thank you, Dr. Ibezi, as well for responding to the question. I think I agree that was like 6 questions in one. Yeah, but it's really worthwhile. I know there are other questions that are on the chat box and also some hands are still up, so we will circle back to them just in about 10, 15 minutes. We are cognizant of the time. I know we have scheduled this to end in less than an hour, but we'll hope to get across your questions very soon. So I'll just share my screen here. I have some slides to project. Just give me a second. Okay, can you see my screen? Okay. All right. All right, so I'll just spend the next few minutes to just introduce the Canadian Association of Nigerian Physicians and Dentists. I'm fortunate to be the president of the association at this point. The 2 main objectives of my very brief presentation would be to, first of all, introduce CANPAD and then provide a high-level overview of our mentorship program, which is also one of the programs that you would have some potential to benefit from as colleagues within the community that we are building. So who are we? So we are basically a health association that represents not just physicians, but also our dental colleagues of Nigerian descent in Canada. We are a non-for-profit organization. We started in 2001 while we were registered in Ontario. We started with very few colleagues, senior colleagues of ours who came together. And one of them was actually on the line here. I don't know if he has left, Professor Ekong. He joined us at the beginning, but he had another meeting at 2 o'clock. I wanted him to just give us some words of wisdom before he left, but I think the questions took priority. So if he's still available at the end, we will still love him to just chime in a little bit of words of encouragement to those on the line today. We have a shared vision of a healthier Nigeria in a healthier world, and this is really what binds us together as an organization. We aim to contribute in a very meaningful way to further advance healthcare system, not just within Canada, but also in Nigeria. And we do this through basically educational and charitable programs and also other social programs that embraces development, science, arts, and culture. What do we do? One of the key things that we emphasize on, particularly for our members in terms of benefit, is professional development. So we take time to organize continuing medical education that is tailored to the needs of our membership. We do play a very strong advocacy role in a wide variety of areas, not just on social issues, but also on issues that pertain to the profession. And for example, issues about equity, issues around diversity, and issues around inclusivity. We also encourage strong physician leadership. We encourage our members to be part of the conversation, to be part of the leadership structures in various committees or boards, as case might be, because we would prefer to be at the dinner table to be served dinner and not the menu to be eaten. So we encourage our members to continue to be cognizant of the part of being in the leadership structure within the organization. Our members also participate in medical missions abroad, both in Africa and other areas where we also participate in diaspora initiatives to be able to support the health system back home to continue to grow. We have currently some initiative going on where we've signed an MOU with the Ekwa Hospital in Egbe, Kogi State. So that MOU have also provided opportunity for us to teach the medical residents within the family medicine department and also provide opportunity for networking with the colleagues back home. We do provide scholarships every year to two candidates. One will have a Nigerian descent and then one will have an African descent. We also participate in providing charity to identified charitable organizations within the country. Networking is a huge one, and I think this is the platform where we have been able to collaborate with IMD Chronicles to bring to you today some opportunity for networking, because it's not about knowing somebody directly, but it is about knowing somebody who knows somebody there to be able to accomplish your desired goals. We take our family and social events very seriously. So in our annual general meetings, we incorporate family socialization that tend to bind us together, not just as professionals, but also as family members of one huge network. In the next few slides, I will just give you a high overview of our mentorship program, which was launched back in June of last year with a single goal of fostering personal and professional development among not just existing members of CANPAD, but also those that are prospective members and looking to join the organization. Within this program, we have over 100 mentees that have been accepted to date. We are currently in the 4th phase of our application. The last phase was back in May of this year. So we have received additional applications and we're currently in the process of reviewing them and also getting back to the applicants. We do recognize that there has been some delay, but we are working tirelessly to make sure that we are matching those mentees with the appropriate mentors. So just an understanding of the mentorship and the way this works, we believe that mentorship basically is a developmental relationship in which a more experienced or more knowledgeable person, whom we refer to as the mentor, helps to guide less experienced or less knowledgeable person in the person of a mentee. We really do see this as a very powerful and necessary personal development tool. And Dr. Shayee have said a lot about mentoring. What we're doing here today is also providing information and then rubbing minds together, motivating you, providing advice that will set you up for success, giving directions, and also having the ability to provide some coaching and supporting to reach your targeted goal. So this is the whole framework of our mentorship program, and we're really happy that this has been welcomed by most of our colleagues that have continued to support the mentorship program since its inception. So here you're looking at the specific objectives of the program. This is really tailored to the needs of the mentee. So we do provide an opportunity for the mentor and the mentee to sit down and identify what goal that the mentee wants to accomplish within the set time of that relationship. So development of a plan and the strategy for the career goals, and the goals could be, you getting your licensure or you getting into the practice, be it pediatrics, be it residency in OBGYN or whatever you want to do. This particular relationship also helps to develop the strategic plan to get you to where you want to be. Exploring different career options as well is something that we have identified here as a key objective. Sometimes you have lots of thoughts in your mind of what you want to do, but the way to get there and the way to prioritize those options and the also comes in handy as part of our objective. Most importantly, also you can see here on the fourth bullet, creating networking strategies. It's all about networking. It's all about networking. This has continued to be a very recurring theme since the beginning of this conversation today. We also want to identify the strengths, the skill gaps, and the areas of improvement. Most of us have very excellent skills from where we're coming from, but how can we tailor that in a way that it will enable us get to where we want to be here in Canada? So this relationship also helps you to accomplish those goals. So by way of program description, we do have mentors who are already established CANPAD members, and those that are willing to commit for a period of 6 months. And this 6 months is just arbitrary. There is also opportunity to extend that relationship depending on the timelines and the goals that have been achieved within the relationship. So they can extend to another 6 months as the case might be. We do accept mentees who could be either medical students or dental students, or medical or dental residents, and also physicians and dentists who are seeking licensure as part of their initial desire here in Canada. And of course, CANPAD members in the early stages of their career. So even those that have already been established, but are in areas where they still need to be mentored. Some are having solo practices in rural and remote communities. So we also do offer opportunity for them to be mentored and be guided in a way that they can hit the ground running. There is a specific steps to get signed up. So first you have to register, and then there will be a matching process. The mentors and the mentee are expected to commit for at least a minimum of 2 to 3 hours per month. And again, this is very flexible depending on the schedule that will be agreed upon by the mentor and the mentee. Meetings could be either in person, virtual, or via phone call or video call, as the case might be. And now that we all live in a virtual reality, so you can mentor somebody from anywhere, not necessarily within the same province, as the case might be. And there is also a mentee-mentor agreement that really lays out the expectation on both sides and what is needed to be done in order that they would ensure a respectful relationship that will be mutual and symbiotic. So this is just a overview of how the program have been structured. So there is a first phase where the matching process occurs. So the mentor and the mentee would apply through our website. I will put the link on the chat box at some point, and then the program coordinator will review the applications and then compile the mentees and the prospective mentors and forward those to the mentoring committee. We do have a 6-member committee that does the matching and the selection. And once the matching is done based on the needs of the mentor and also the expertise of the mentors, they will then start the relationship. There will be a 6-month period when the mentee will then contact their mentors to get the agreement signed and then lay the foundation for the mentoring period, which will then begin once the agreement is signed. There are benefits, to this program in terms of the applicants who are coming in as the mentee. First of all, you get to learn from the colleagues who are already well established in the system and understands the Canadian health system and how to navigate it. You also gain an understanding of the culture, the ethical parameters, and the legal dimensions of our medical practice, not just within your local area of practice, but of potential practice, but also provincially and nationally. You create good a professional relationship and also putting a personal touch to it, because come to think of it, look at the personal stories that have been shared today by both Dr. Shayee and Dr. Ibeze. These are things that will inspire you. And you don't hear this often elsewhere, but within the framework of the mentorship program, these are the stories that we continue to share with people on one-on-one basis. There are also opportunities to access relevant study materials that will support you in your exam preparation. You've heard today that there are tons and tons of exams to write depending on the province. So we connect you to our colleagues that will support you within that relationship. And of course, you learn about the skills and the attitude that is needed to be successful in navigating the health system. No matter how bright that you are, no matter how intelligent that you are, but if you don't have the right attitude, you can miss the boat. So these are some of the benefits that you can derive from that the mentee-mentor relationship. What about the mentor? We continue to encourage our physician colleagues and dental colleagues to sign up as mentors. There are immense benefit that you could see on your screen there. It helps you create new professional networks. So I'm very fortunate to see all of you here now in this community that we're building. That is a new relationship. It also creates the opportunity for you to have personal relationship with the mentees. And of course, being somebody who is providing guidance, you tend to learn more in terms of your leadership and your teaching experience. You also obtain professional development credits for those that capture the hours as part of their CME activities. You can expand on your own skill sets as you learn more, because it is a symbiotic relationship. Mentors don't know it all, but they also have something to learn from the mentees. And of course, they get to share their wealth of knowledge and experience, not just any kind of information, but those information that you cannot get in the classroom. You cannot get them elsewhere, but you can get them from those that have won the boats back in the days. So this is just slide describing the skill that is needed by both the mentor and the mentee. But I'd like to draw your attention there on the right side of your screen in terms of the skill that is needed by the mentee, which is confidentiality in keeping the trust. So this symbiotic relationship is all about respectful relationship. It's all about trying to identify the desired goal and then work with the mentee and the mentor to get them to where they want to be. In terms of expectations on the side of the mentor and also the side of the mentee as well. So you can see there again, the mentors are there to provide support, to share relevant knowledge, and then and also challenge the mentee to really step up their game and then push them to that limit where they can get to their desired goal. On the side of the mentee as well, they take responsibility, they demonstrate good time management, and they'll be responsible for setting up meetings and also keeping track of their achievements and the timelines that are being accomplished, and also sharing concerns that might be arising from the relationship. For both of them, of course, we expect that there will be trust that will be demonstrated. There will be commitment on both sides to get the goals accomplished. And of course, communication is very, very important. And sharing ideas and providing constructive feedback continues to be an expectation on both sides. And if the relationship is not working, maybe the mentor is too busy, that will also be an opportunity to refer back to the coordinator to say, please, can I get another mentor, because I have not been able to establish that connection with my mentor. So it's very fluid and very friendly. Thank you very much. That's just the brief on the mentorship program. And currently we are in phase 4. Like I've said, some of you that might have applied since May, we will be getting back to you very shortly here. We're just still scouting out for additional mentors to be able to match those that have applied. So this is our website there, and then you can find also additional resource on the mentorship program. Thank you very much.
Wow, thank you so much, Dr. Undibuka. That is very insightful. We're grateful. I would like to mention here that Dr. Ndubuka became president just 2-3 months ago, sometime over the summer, you know. So even though he's only occupied this seat for such a short time, you know, he's done a lot in that space of time that I have been in Canada for at least 5 years, right? Like I mentioned earlier. And I did not have all of this information. CANPAD wasn't even doing this then, right? So these are new initiatives by CANPAD, and you know, it will continue to get better. Dr. Undubuka, something I would like you to please speak on is how do we become, you mentioned, yeah, being members of CANPAD, right? But how do we access these resources? I believe they are dues, you know. Your heart is where your money is. It doesn't matter how small they are, you know. Can you please speak to what these dues are?
Thank you so much, Dr. Shayee. The CANPAD membership, we have several categories. So we have categories for members that are practicing, we have categories for associate members, and we also have categories for students and residents, and also those physicians that are not already in practice, but are undergoing the practicing or licensure journey. So for full membership is $350 Canadian, and for associate members, $350 Canadian, but for students category, residents, and those IMGs currently in the licensure journey is $50. So I will put the link on the chat box that will take you to the website where you can see the different categories of membership, and these are all the benefits that you can get once you are registered. Thank you.
So thank you, Dr. Ndubuka. So invariably what you're saying is that as IMJs, you know, in recognition of the fact that we haven't started earning the dollars, right? We are going to be paying 15% of membership dues, and we'll get all of this opportunity. You know, I think that's very laudable. I think that, I don't know if that is new, but we are very appreciative of that. And that speaks to how much, you know, you're supporting us, you know, and it feels really nice to know that people ahead of you are rooting for your progress, right? Rooting for your success. What if you're assigned to a mentor who doesn't respond? What do you do?
Yeah, you can reach out to the coordinator, the CANPAD mentorship coordinator, and I'll put the email address as well on the chat box, and they will be able to reassign you to a different mentor. Just being mindful that there might be some lag in the communication, so just still bear with us. We just recently engaged a company to manage our admin. So we're still kind of, you know, working through to put some guidelines in place and to be able to facilitate our response to inquiries. So if you don't hear back from us in a day or two, just know that your requests have been received, and we will attend to it. Thank you.
Thank you. And well, I'm only one person, but I try. So if you do try and CANPAD is not responding to you, I feel responsible for bringing us under this umbrella today. So send me an email. You know, my email is info@drshayee.com for everything IMD Chronicles. And I will, you know, light up the fire over there and say, what is happening? You've collected our dues. We have been matched. Our mentor is not talking to us, you know. So please send me that, you know, but I'm optimistic that you know, it's going to be well worth it. And you know, just like everything new that is starting, we would always have hitches, you know, but then the following year is even better for the next person. You know, and I would use this opportunity, you know, for those that are practicing here, you know, who are part of this meeting today, who are in practice already. If you haven't signed up as a mentor, you know, we have more mentees than mentors right now. Please do so. It doesn't matter how long you've been in practice, right? So please do so. There's always somebody who will learn from your pool of experience and your journey and what you're currently doing. And I, for example, had someone's mentee reach out to me 2 months ago. So the mentor is in Saskatchewan, the mentee is in Alberta, and I have never met the mentor physically. But he sent me an email saying, this is the name of my mentee. Please, if you don't mind, to reach out to you and blah, blah, blah. And I spoke with the mentee and I was able to connect with the mentee with someone who was here who wanted to hire. The mentee had completed her exams. She was in the practice ready process for Alberta. So she had everything. She was just waiting, for that opportunity while officially waiting, but also unofficially looking at her contacts and seeing, and I was able to connect her with that clinic. So those are just some of the kind of things that can happen when we support one another, you know. So thanks again, Dr. Undubuka. I would like to address Joy's question. So Joy
Oh,
is,
sorry, Shayee, can I just say something now?
yes, please, absolutely.
Regarding CANPAD and the presentation. Thank you very much, Dr. Duka. That was very thorough. One thing I have to add, he mentioned about mentorship for early career physicians. It is because it might seem that as soon as you get into the system, you're done. But the truth is that you're not done. You need guidance, you need mentorship and sponsorship. They are two different things, and it's something that everybody should know about. You need mentorship and sponsorship because one, learning never ends. But the other important thing is there are some things that you learn on the job. Things like your billing. Your money is important. You need to learn how to bill properly. You need to know when there are opportunities for you to move on to other things. You're buying a practice, you need to learn how to negotiate. How did other people negotiate? How much did they pay to buy into a practice? What does a contract look like? So these are things that you can get. You can't search them up online, unfortunately. You might go for a billing course, but there is the one-to-one that is missed unless somebody tells you that you can do this, you can bill for this. But especially if you're done and you want to get into practice your contract, it helps to have somebody who can help you look through your contract and tell you if it's fair, if you can get something better, if you're paying too much or too little for a service or for buying into a practice. And it even helps even more when it's free. If somebody's doing all this and you're not paying the lawyer to look through your contract, of course you still get to the lawyer stage, but somebody who has been through the process, looking at your contract and telling you, go for this, don't go for this is fantastic. It makes so much difference. So when you're paying your $50 per year for CANPAD, and then you qualify, it's important. It is very valuable to pay that step up to still be part of CANPAD. That's just what I wanted to point out.
And that is not just, that is big, Thank you, for hammering that again. That is very important, It's important to leave a door open, not just walk through it and shut it behind you. And I'm a testament of that, doing that. I'm not the only IMG who has no residency in Canada, but why am I doing this, right? Leaving that door open so that if I open it for one person and that person opens the door for 10 more people, then, is a job well done. So Dr. Basic, thank you for stressing that is important. So I will go on to Joy's question. Joy is talking to us from the Caribbean. I don't know if she's a CMG or if she's an IMG, so I'll tell you the difference. So an IMG is me, meaning I did medical. I came here as an immigrant. I did medical school outside of Canada, trained outside of Canada, and now I come here to work, to want to integrate. A CMG is Canadian, so either by birth or by economic migration, but somebody who who was born here or who was raised here, right, and couldn't get into med school here. It's very difficult to get into medical school here, even worse than residency. And I think one of the primary reasons is we've got very few schools. You know, Canada is huge. There's immigration manual every day, but those hospitals haven't changed, you know, so the numbers are very few, training opportunities are few. So you have people So you have people who travel abroad to study, you know, and I look at myself sitting on the other end of that table. If I am a program director and I've got this green, young, fresh graduate from a school somewhere in another developed country in the world who is coming back home to Canada, and I've got this 40-year-old IMG from one developing country, you know, and I put two of them together, who will I feel is going to be more trainable and malleable? I probably will feel the younger one will, you know, that the older one may be more set in their ways. And that is one of the things that they worry about with IMGs coming into training. They feel like many times, many of us have behaved that way, you know, like we know it all. And even when we taught the same thing over and over, you know, we still do not take that cultural competency and act it, you know, that patient-centered care, we're still not getting it. We're still doing our doctor-centered care from our home country. So those are the things that will hit you in the face. But that is not to say that is the status quo. If it's not, because if it was, I wouldn't be here. So if you're if you're a CMG or an IMG, if you're coming from the Caribbean and you're coming back to Canada, you will do those exams, you know, and unfortunately, our standard changes from year to year. That's why it's difficult to keep up. That's why I try to do this, you know. So at present, the exam called evaluation examination is scrapped. Your QE1 is the exam to do. And after that, your clinical exam at this point is revolving around COVID. What is the COVID situation like? So because of COVID, people couldn't take the NAC and the QE2, which is another clinical exam about last year, you know, but this year, the NAC exam, you know, was taken last weekend and 2 weekends ago. Maybe done in a different way from what you're used to, you know, but it was done, right? So right now you need your NAC exam, you need your qualifying exam 1, and depending on the province where you are, you may need some additional exams. So in Alberta, where I reside, you're going to need an exam called the MMI, you know, the mini multiple interviews. You know, is a one-day exam, kind of structured like an OSCE exam to really test your psychology, really. So that is, but that is only in the province of Alberta. So for residency, it's important to stress that it is different. The criteria is different, province to province. So where do you get the information you need for what is current? It is the CAMS website. I'm going to put it on the side here when I'm done talking. So the CAMS website, that's the Canadian Residency Match Service. You click on the province you want to apply to. You will see the list of schools. You click on each school, because in each school, you click on the program you want, because each program, even within the same school, may ask for something different. So it's quite a convoluted process. It's time consuming, but you have to do the work, you know. So that is the best way to get current information as to what is happening in that current CAMS cycle. So I hope that has answered your question. Yinka from Ontario is asking about public health. Yinka says, what if I'm not interested in clinical practice? You know, so Dr. Undubuka, can you please tell me how to get a job as a medical officer of health? What do I need to do? So that's Yinka's question.
Thank you so much, Inka. The public health physician position, of course, is a licensed position. So what that means is you would have to get on the minimum your QE1 requirement. It used to be the evaluating exams back in the day, but that has been scrapped. So the minimum you require is to pass your QE1, and of course your English exam. Depending on the province, not all the provinces accept physicians without residency training. So just a few that accept those with a master's in public health or an equivalent degree or even a PhD. And those few provinces will be Saskatchewan, Alberta, and also some communities in northern BC. So once you have those, of course, there are sites where you can visit to explore what opportunities are there. They are often being advertised, and in the advertisement they will indicate that also an option would be for those that have masters in public health requirement. So those will be the ones that you can go for. Unfortunately, those opportunities does not exist in other areas, including Ontario or Quebec. So you really have to come to the prairies to explore those. But I must tell you that because there are very few positions really for those public health practice per se, the opportunities are not that much, but that doesn't mean that one cannot try. Given the COVID pandemic, I think there has been a lot of interest that have been generated around public health. So also that has created additional opportunities for job expansion, position expansion in those areas. So I think once you have those key criteria or eligibility criteria met, then the job search will continue. But I think also networking is important. So if you keep in touch with me and other colleagues that are into public health, when those positions come up, we can always touch base with you to apply. But I think being ready and also tailoring your CV to be strong towards your experience in public health, that also adds value. And hopefully you will get to your desired position. Does that help?
Thank you, Dr. Undubuka. I think this is a good time, to introduce someone who has just gotten a public health opportunity. Even though it's clinical per se, but you may learn one or two things from her as well. So I would like to introduce our very special guest. Her name is Dr. Yvonne Ifeguma. Dr. Yvonne, you've got the floor. I don't know if we've been.
Hi,
Awesome. All right.
Hello, everyone. I'll try to be very brief because we are almost running out of time. Dr. Shayee approached me yesterday to share my story. Well, I came to Canada in 2017. I just completed my residency in Nigerian public health, and then came in finding the best way to get into the system. So I started by writing my exam. So I wrote the QA1 in September of 2017, and then the NAC in March of 2018, and then the Q2 in May of 2018. And meanwhile, I was also working as a healthcare aide with Nurse Next Door, because you need to pay the bills while you're writing your exam. So afterwards, I decided to pursue a master's in epidemiology at the University of Calgary. So it was a 2-year master's thesis based, which I started in the fall of 2018, and I completed last year as well. And after my master's, so I finished my master's I think I did my thesis defense in July, and then I started job hunting. And then I felt, well, I already have a master's. I mean, I'm going to apply. It's so easy to get an epidemiology role, but it wasn't that easy. I was shocked. Like, I was throwing in my CVs and my applications, and sometimes interviews come in and then you get the rejection email saying, we're so sorry, blah, blah, blah. And I was like, wow, this is serious. Like, I thought once you have an education in Canada, everything is going to be sweet sailing. But I eventually got a role as a research coordinator, I think in December of last year, while I was pursuing my CAMS application. And I applied to family medicine in the first iteration, and I didn't get any interview. Like, I don't know if anyone here has applied to CAMS previously, but there's a portal where you kind of follow up on your application, and then when there's no interview, there's like an X mark and you're like, okay, that's gone. And then you just see all the X marks for all the schools I applied to. And I'd given up. I said, well, thank God, at least I have a job. I'm working as a research coordinator. I'll apply next year. And then second iteration was opened and I saw the position for public health and family medicine. And that's actually what I wanted. So in first iteration, that position wasn't open to IMGs, it was open to only CMGs. So I decided to apply to just family medicine. And I felt once I'm done with family medicine, I have my public health background, I can now like mix up whatever I want to do with both family medicine and public health. But since that didn't work out in first iteration, now I'm seeing second iteration where there's this position where you have the family medicine and public health combined program. It was a CMG position in the first iteration, but no CMG match to that seat. And so I applied, and to my utmost surprise, I got an interview request. And I think I got the interview request like on a Wednesday, and I was meant to have the interview the next day. So it was really crazy. I didn't have time to like go through the interview preparations and practices. I was working that day and I didn't get off work till about 7 p.m. But to cut the long story short, I'm happy I matched. And I've started my program here at the University of Alberta in Edmonton. It's been nice. So the first 2 years is family medicine and then 3 more years of public health training. And my encouragement to you is never give up. If it doesn't work out in the first iteration, some people match in the second iteration. And I have a friend that even matched post-match, meaning that after the second iteration, there were still some available seats and she applied and she got into a residency slot. So keep moving, keep pushing. Whatever you're doing now, don't give up. Don't try to avoid gaps in your CV. Keep busy. Whatever you're doing is going to be relevant sometime, someday. Thank you so much.
Thank you so much, Dr. Ifeguma. Once again, congratulations on your residency, because she has got a very coveted position. They've stopped giving that position to IMGs, they've only offered it to CMGs. Actually, at the University of Calgary, there's 0 public health slots for IMGs at present for the last 2 years. So it was one thing to get into that position, which is a dual license, but it was also mind-blowing that she got it as a second iteration. So this is not someone who got several interviews the first time. This is someone who got 0 interviews, right? So I really wanted her to share this directly, and thank you for honoring this invite despite my late asking last night. So I appreciate it, but why I wanted her to say that to you is some people have tried and they didn't get in, right? Some people have tried a second time and didn't get in, but you need to ask yourself, how badly do I want this? I know someone who said, I've tried 5 times. I won't try 5 times, but you need to ask, what are the things in my resume that I'm changing from year to year? If nothing is changing, then it's like backing down a closed door. But if you're adding something every year, irrespective of how little you think that is, that may be the change. But at the same time, I'm also someone who's very pragmatic. Some people are not like that. But for me, by the time I'm trying a second time, I would also be thinking about my plan B. And if my plan B doesn't work, about my plan C, but not everyone is like that. Some people will try again, improve on themselves and give it a try. So what I hear from Yvonne's story is she came here and she improved on her resume by doing a master's. That is not to say everyone who does a master's, it happens that way, but it's not just one thing they're looking at. They're looking at your CV in its own entirety and what you've done at every given time, that gap. If you have a gap, what did you do during that gap, So I think that is something very laudable. So thanks again, Dr. Ifeguma, for sharing your experience. I will go back now to our question session. Somebody's, Dr. Ibezi answered a question on GP training that you do not need exams for Saskatchewan aside the QE1. But I want to remind everyone that each license is province-based. So you cannot transfer your license from Saskatchewan to work in Alberta. So our licensing body in Alberta is called the CPSA. You know, the one for Saskatchewan, I think, is the CPSS. For Ontario is the CPSO. So that name at the end is what changes depending on the province. So Dr. Ibezi said earlier, don't be afraid to pick up your phone or email, you know, ask from source. I like that, asking from source. So you get it firsthand, you know, because someone may have done it in 2020 and this is 2021. So it is different. I know someone who just came back home from the UK. He has just completed his residency program in the UK and he wants to practice in Alberta. And what they're currently asking him for some things in Alberta that they're not asking him for in BC and in Saskatchewan. Those are easier provinces for him to get a practicing license, according to what he told me last week, right? So please reach out to that province where you want to practice when you're ready, and they will tell you exactly what. But in the interim, regards your exam, you can start. It doesn't matter where you are, you need your QE1, you know, to get that license. But they will still give you the reciprocal of the CCFP, you know, which is your Royal College certificate. You'll get that equivalent. But even if you have your Royal College, if you haven't done that QE1, you know, they wouldn't reciprocate it. So just ask from the body directly when you're ready. And as for Blossom, Dr. Ndubaka answered your question earlier on mentorship, observership, shadowing. Across provinces, opportunities are different. But if you live in Alberta, there is a very, very important group called the AIMGA. I have put it there. And that group stands for Alberta International Medical Graduates Association. I benefited so much from them. So just look up their website. They offer exam preparation, interview preparation, camps preparation. So a very good support group. And they also match you with practicing family doctors within the city. So these are doctors who have volunteered, you know, to have IMG shadow them, you know, so it doesn't matter, you know, where you're from, you know, it is for all of us, you know, Nigerian, Iranian, whatever country, whatever color, you know, as far as an IMG or a CMG, somebody who wants to integrate back, you know, and you reside in this province, you can access their services. So I encourage you to join them. And then me on the personal level, aside the IMG Chronicles, I have this WhatsApp group that that I share, you know, it's supposed to be like a support system but different. Thank God, you know, we are changing the culture. So the culture of that we bring from back home in Nigeria, where you think of me, myself, and I, now we're thinking of ourselves together, you know, and there I've encouraged and people are really acting up on, you know, so people who have done the Q1 exam, I'm mentoring people in the process, you know, sharing materials. So we have different subgroups there, you know, so CAMS is one of the subgroups. So people who have gone through the CAMS process for this next CAMS process, they're mentoring people, you know, so whichever process, wherever you are in that journey, reach out, you know, either through CANPAD or through IMG Chronicles, somehow we'll find a way to connect you, right? And that's the whole essence for this conversation. So at this time, it is 3:02. Somebody said, how can we join this group? I have my email here. Send me your phone number as well as your name, and we will add you onto that group. Very important to mention, you know, this was CANPAD. CANPAD was a Nigerian group. I've gone out to ask about other ethnicities and their groups. The Pakistani community sent me their group. Let me share that with you. They sent it to me this evening. It is called MD International. So I'm just going to put it here for anyone who is Pakistani and so MD International. And when I have a link to their site, I will share it on IMG Chronicles, you know, so you have it there. And for all the other subgroups that have communities, I've reached out to people, and as I get those contacts, I'll share it on IMG Chronicles, you know, just to reach out to another inner support system, for you. So I think we have talked. Dr. Ure Z, do you have a question? Your hand was up for the longest time. Okay, the hand is down. Okay. Before we finish the meeting, we've got someone I'd like to introduce here. Her name is Rosa Martinez. Rosa met me on LinkedIn, and she does work with immigration and all of that. And she said, how can I support IMGs? What can I do? So I'm seeing Rosa for the first time today. And during this meeting, she sent me her email. So we're going to be sitting down at some point, tete-a-tete, and we talk about our problems and how she can help. So thank you so much, Rosa. For those who English is not your first language, language is very important. Another organization, a big organization, reached out to me on how they can support us, So I'll be sharing their contact on IMG Chronicle. So if English is not your primary language, you can connect with them as well for support. Dr. Ibezi, Dr. Ndubuka, do you have any final comments?
I wish to recognize someone very important who just popped in and turned off his video. The recent, the president of CANPAD that just left. Oh yeah, his video is back up. Back to you, Amy.
Good afternoon, everybody. Good evening, those of you in Ontario. Apologies, I had this meeting on my mind and I forgot that it was EST, so I joined at 3 p.m. Saskatchewan time. But I'm happy for the good work that Shayee is doing. And thank you, Somto. Thank you, Dr. Namdi, for all the work that you guys have put into this. Yeah, Dr. Namdi is the current president and I'm the past president of CANPAD. And please, I just want to encourage everyone on this forum today to take advantage of this initiative. These are people who are concerned about you and interested in seeing you integrate well. Rosa, thank you for reaching out to our community. We really appreciate you, and whatever we can do to support you as well, please let us know. Shayee, thank you very much. God bless everyone.
Thank you, Dr. Lauche, because, so even though he has handed over, he has not handed over, right? And that's what we say about mentorship, and leaving that door open. So Dr. Lauche, because there were a lot of firsts that he did as president. He was a president that was not tired. And it was because of his involvement, I reached out to CANPAD, recently we've been hearing the buzzword equity, diversity, inclusion, post-George Floyd. A lot of people wanted to let it go, and I didn't know Dr. Olache become, but I did have an experience that, it was a learning curve, but it was an experience based on the color of my skin while I was a resident. And he reached out to me from his province. He said, I heard this. How can we get involved, And I mean, I was very impressed, right? And he didn't need to get involved because my university treated it with all of the urgency that it deserved. And I'm happy about how it turned out, but he reached out. And this was me who had not paid a dime of membership dues. So Dr. Lache, because we are honored by your presence here this evening. Thank you for all you do for the association and for us. And I know that many people here, we join the family. And again, thank you to everyone who joined this meeting this evening. What affects you is important to us all, and we're here to guide you through this journey in the hope that you will be guiding some other people when you have gotten your license, right? So it is a journey, it continues. So that is why I'm not calling it Dr. Shayee's journey. I call it the IMG Chronicles because it is all of our journey together. So to all my bosses here, Dr. Ibezi, she was the one who has been assigned my mentor by Black Physicians of Canada. You know, we didn't, believe me, we didn't want it. We didn't ask for it. It just happened by chance, you know. So it's by someone who is just starting the profession in this country. It doesn't matter what I've done before. You know, she has gone ahead of me. So I see her as my John the Baptist, right? And even though we're in different provinces, sometimes I ask her, oh, I'm thinking about this. I was offered this. What do you think? You know? And so thank you so much for your time, for your presence here today. Professor Ekong, I don't know if he's still here, but I would like for you to please give him our thanks. So he's the neurosurgeon, right? And he is a daddy in Canada, you know, so we're grateful that he popped in this evening. And to all of you, our subscribers, without you, there'll be no IMG Chronicles. We'll continue to do this good work. So thank you for joining in. As for the recording, Kikelomo, you will get it, provided there are no technical issues. At least NEPA didn't take light, so we don't have an excuse. So we will share it. Any last comments? If you have any last comments, feel free to unmute yourself. Any participant who has a last comment.
I could go ahead. I just wanted to say thank you guys so much for this. I joined late because I got the timing wrong, but I've been really inspired, you know, by Dr. Yvonne, Dr. Shayee, Dr. Namdi, Dr. Ibezi, Dr. Adeyemi, you know, just thank you so much. That's all I have to say.
Thank you. Thank you, Kikelomo. And I'm sure you echo what a lot of people are saying, you know, so we are mindful of the thanks and we appreciate you all. So have a good evening, everyone. No candies, trick or treat. Happy Halloween evening. All right.